Diet and Diabetes, Chapter 19, page 399. If you have the new textbook, you can mention the new page number in the chat box. 406 in new textbook. If anyone is joining late, please help them out with the page numbers. So diabetes, it is a chronic disorder in which the body is unable to utilize glucose, either completely or partially. And that's why if the body is not able to use glucose, glucose will stay in your blood. Okay, in an ideal situation, the glucose that is there in the blood has to be taken up by the cells of the body. If the cells of your body is not taking up the glucose, glucose will stay in the blood and it will keep the blood sugar levels high. Okay, and along with that, high blood sugar level for a very long time would lead to inflammation and other inflammatory disease conditions. Okay, so glucose concentration in the blood will remain high and it will change the way how your body uses carbohydrates, fat, protein for metabolism because the cells need energy from glucose. And if the glucose is not entering the cells have to find some other way of getting the energy. Okay, so the metabolism processes and all the choice of macronutrients for metabolism changes. Okay, now why does this happen? Why does how does diabetes happen? In a healthy situation, insulin is secreted by your pancreas. Okay, pancreas. There are cells in pancreas called the islets of Langerhans. Okay, islets of Langerhans. There are alpha cells and beta cells. Okay, beta cells are supposed to secrete insulin. Alpha cells are supposed to secrete glucagon. Okay, insulin is secreted by the beta cells of the islets of Langerhans in pancreas. Okay, and this insulin knocks, imagine a situation in which insulin is knocking on the cell wall, the cells will open the door and glucose will enter. Okay, so insulin is that mediator that enables the entrance of glucose into the cells. So if insulin is not there, glucose cannot enter the cells. And even if the insulin is there, but the cells are not responding to it, again, glucose cannot enter the cells. Okay, so there are two cases. In type 1, what happens is that pancreas do not produce insulin at all. So there is no mediator to push glucose inside the cells. Okay, that is type 1 diabetes. In type 2 diabetes, insulin is being produced more than the actual requirement. Okay, but the cells are not responding to it. Okay, cells don't respond to insulin, so cells don't open their doors for glucose to enter. Okay, so glucose as well as insulin, both of them will stay in the blood. Okay, pancreas will think that, okay, let's produce more insulin, so the cells will approve glucose inside. Okay, and even with the increased production of insulin, the cells fail to respond. And the blood, what happens in the blood? Insulin is also pumped to a larger extent. Glucose is also not entering the cells, so glucose also stay back in the blood. Okay, so we get a situation in which hyperinsulinemia, hyperglycemia. Okay, both these situation will happen in type 2 diabetes. Okay, pancreas have the ability to produce insulin, but cells don't have the ability to respond to insulin. That is the difference. Okay. So this is the islets of Langerhans, the cells in your pancreas. There are alpha cell, beta cell. Beta cells will release insulin, and when insulin is released, whatever blood sugar is there, okay, it will go down because that is now going into the cells. Okay, alpha cells do the opposite thing. They release glucagon and they increase the blood sugar level. When you go into a state of hypoglycemia, your blood sugar level, when it rapidly falls down, okay, glucagon is secreted that will increase the blood sugar level. Okay, glucagon usually will enable the liver also to for gluconeogenesis. Okay, and because of which the blood sugar level increases. So from an epidemiological point of view, diabetes is highly prevalent in India, and the rate at which people are getting diabetes is increasing, especially in the urban population. Okay, it's estimated that around 61.3 million people in India live with diabetes, and out of that, around 70,000 are kids who have type 1 diabetes. Okay, type 1 diabetes is still on the rare side, but type 2 diabetes is very common in Indian population. Nearly, we are expecting around 9 lakh deaths directly or indirectly related to diabetes because it's a lifestyle disease. Okay. And if you see the Indian population, South Asian population in general, we have a risk of getting diabetes earlier as compared to the same population in Western countries, because in India, diabetes is not related to obesity like how like how it is in Western countries. People who are obese, they are the ones who have the risk of developing diabetes. But in India, you don't have to come under the obesity marker to get diabetes. Okay, it's because of the genetics in Indians that we have, as a population, we have suffered through a lot of famines in our past. Okay, ancient India. Okay, the India under the Mughals, India under the British. Uh, Famines were either natural or created, man-made famines as well as natural famines. Indian population has suffered through. Okay, utter poverty, lack of food. Okay, these things Indian population have suffered through, and because of which our body is made to survive in scarcity. Okay, the Indian body is made to survive in scarcity. When you don't have enough food, but your bodies can still survive. Okay, but when the globalization happened in the 1990s, okay, access to food, when it increased, okay, your bodies are still the same. Your body is made, the Indian body is made to survive scarcity, but there is access to food, and that too access to calorie dense food, not nutrient dense. Okay, so because of which the it triggers quick diabetes in India. Okay, your body is supposed to survive through low calorie diet, but now you are having high calorie diet. So as a response to that, Indians get diabetes way too earlier than Western counterparts. Okay, we don't need to get obese to get diabetes. Okay, even if people are slightly overweight, or even if they have a normal BMI, they will get diabetes. So types of diabetes: type 1, type 2. Type 1 diabetes, it occurs when pancreas are unable to produce insulin at all, and it usually happens at a young age. Okay, it cannot be prevented. You require insulin therapy and all for this. And both share the symptoms of frequent urination, increased thirst, extreme hunger, unintentional weight loss, fatigue, blurry vision. Both these symptoms are there in type 1 and type 2. Type 2, as you know, just now we have discussed, it's because of insulin resistance. Okay. And type 2 diabetes is usually it happens in older people, not in young age. Young kids still can get type 2 diabetes. There are cases of that as well. Okay. Kids who are obese from a very young age, okay, they tend to get diabetes early, and you can prevent this with lifestyle changes. But type 1 diabetes, it is not preventable. If you get type 1 diabetes, lifelong you have to be on insulin therapy. Not all type 2 diabetes will require insulin therapy. Some with metformin and all these kind of drugs, with that you can combat. But symptoms in both the situation, it is same. Heavy emphasis should be put on lifestyle modification, diet plan, physical activity, blood sugar, frequently checking the blood sugar. BP, checking the stress, getting moderate exercise. Okay, these things has to be done. Coming to etiology, etiology means why, what is the reason that diabetes happen? Okay, first is your genetics. If grandparents and parents suffer from diabetes, you also have a high risk of developing diabetes. Okay, your risk factor is also threefold. And even in case of type 1 diabetes, it is also genetic. Okay, if anyone in the family is suffering from type 1 diabetes and they have kids in the future, kids also will have a risk of developing type 1 diabetes. Okay. Then other factors like infections, in some cases of viral infection, it can set on a series cascade of autoimmune response as well, in which your own immunity will start attacking your cells. Here, pancreatic cells will be affected, and that's how type 1 diabetes can develop. Okay. Then acute stress. During stress, okay, when you're undergoing stress, your blood sugar level alters a lot. Okay. They usually stay high for a very long time if when you're undergoing any stress, and this could lead to diabetes. This could lead to ketosis and diabetes. So in for example, for many of midlife adults, okay, people who are in the midlife in late 30s, early 40s, if at all there is a severe stressful event during this age group, okay, adults who are in their midlife, if there are any severe stressors which they are not able to manage, okay, that can push them into diabetes. They may be healthy, they may have a healthy diet and all, but severe stress that happens during the midlife in adulthood, that can also push you to diabetes. Then immunological factor, type 1 diabetes, this is the reason that can only apply to type 1 diabetes. Okay, that is an autoimmune disease. If your immunity is attacking your pancreatic cells, it is an autoimmune disease, and that becomes a type 1 diabetes. Then the type 2 diabetes, lifestyle, genetics as well in this as well, but lifestyle plays an important role. Those who are obese, underactive, those who overeat, okay, they have obesity from a very long time, they are at the risk of developing diabetes. High intake of refined grains, uh, junk food, trans fat food, okay, that can lead to diabetes. With age, after you cross the age of 45, most of the diabetes, type 2 diabetes is getting diagnosed after the age of 45. Okay, that is very common. Abdominal fat, people who have a high waist to hip ratio, which means people who have an apple uh, kind of body shape, men and women. Okay, you carry a lot of fat in your abdominal region as compared to your hip region. Okay, so that is the high waist to hip ratio, in which A lot of fat is there in the abdominal region, okay, the peritoneal cavity. Okay, that is an indicator of high risk of developing diabetes. And it can also be predicted in people who have a waist circumference which is more than 90 centimeters. For men and women, if your waistline, if it is more than 90 centimeters, you can have diabetes, risk of developing diabetes. Then insulin resistance, as I mentioned, cells are resisting insulin. Cells are not responding to insulin. So that leads to blood glucose levels in your blood staying high. Okay, it is not getting into the cells. That is a situation called insulin resistance. So if you manage insulin resistance initially, you can push diabetes off as long as possible. Okay, but if you have been suffering from insulin resistance from the past 5 years, 10 years, in case of PCODs and all, women who suffer from PCODs, insulin resistance is very common. Okay, so if you're undergoing this kind of situation, it means it could lead to diabetes. Insulin resistance can push into diabetes. How do you manage insulin resistance? Soon after you have a big meal of your day, like lunch and all, or dinner, or heavy breakfast. Okay, in whichever meal you consume a lot of calories, soon after having that meal, walk for at least 10 to 15 minutes. Slowly, okay, that is also fine, but at least keep your body moving for at least 10 to 15 minutes. That will push your cells to take up the the glucose from the blood. Okay, so that's how you can prevent or control insulin resistance. If you have zinc deficiency, okay, correct that as well. Taking zinc supplements, that can also prevent insulin resistance. So this is a cycle of insulin resistance. You eat food, pancreas are making insulin, but cells don't take up insulin. Blood as well as insulin will stay in the, sorry, glucose as well as insulin will stay in the blood. And that excess sugar, which the blood is storing up, that will convert into fat. Okay, that is your body's response to prevent diabetes or prevent inflammation, that whatever whatever additional sugar that that your cells have not taken up and it is there in the blood circulation, that will be converted into fat and it will be stored in your body. Okay, that's how you eat food. You put on weight, but you're not losing weight. Okay, and you feel tired as well. You're tired and hungry because cells need energy. You had food, but cells didn't take up those glucose for energy. So your body is still hungry. Okay, so you eat food, you're putting on weight, but you're still hungry. Okay, that is what the cycle of insulin resistance is. So, what are the symptoms of diabetes mellitus? First is hyperglycemia, as I mentioned. If insulin is not produced, or if insulin is not, the produced insulin is not effective, okay, glucose will stay back in the blood, and that is hyperglycemia. Too much of glucose in blood is hyperglycemia. That can lead to inflammation and other disease conditions. Okay, because it will convert your blood into acidic. It will convert the blood acidic into in nature, and that is inflammatory. Okay, so that is hyperglycemia. Then glycosuria, when you have too much of glucose in the blood, and when this blood goes through the kidneys, okay, when this blood goes through the kidneys, kidneys will filter it out. Kidneys will filter out the excess glucose. So what happens? Urine will, through urine, there will be too much of glucose that has been lost. So that is a situation of glycosuria. Okay. Then fluid electrolyte imbalance. When there is too much of glucose that is lost through urine, okay, it will pull out other electrolytes as well along with glucose, okay, because glucose is substantially a bigger sized molecule as compared to other electrolytes. So if the kidneys are pushing out glucose in large quantities out of the blood, a lot of electrolytes are also getting lost in that process, okay, so that would lead to fluid electrolyte imbalance. And also you urinate a lot, okay, when you are diagnosed with diabetes, okay, or you're in the pre-diabetic stage, you urinate a lot. That is your body's way of pushing out the excess glucose out of your body. So in that process you lose a lot of electrolytes as well. Then you have acidosis. The pH changes, okay, your blood pH and all, it changes usually because too much of lipids that your body has stored, since glucose is not getting giving you the energy because cells are not taking in glucose, there is a lack of energy. Cells need energy from somewhere. The second option is the fat that has been stored in the body, okay, so that will be broken down. That fat will be broken down to give energy. So in the process of breaking down the fat, lipolysis, a lot of ketone bodies are released, okay, the fatty acids and ketone bodies, they are released, okay. The blood gets filled with small fatty acid molecules, so that makes the that will make the blood into acidic in nature, okay, that leads to acidosis. Too much of ketone bodies and fatty acids in the blood because of rapid breakdown of fat from your tissues, okay, your body goes into a state of acidosis. So what are the signs and symptoms of acidosis? You will have a very fruity odor because acetone is released by your lungs, okay, so that will give a fruity odor to your breath will smell like some fruit, okay, it will give fruity odor. Too much of ketones are secreted in the urine as well, ketonuria. Lack of concentration, inflammation, so these all will be the signs of acidosis. Then polyuria and nocturia. Glucose increases the osmolality of your GFR rate, thus it prevents the reabsorption of water. So that is the reason why at night you urinate a lot, and also during day also you urinate a lot, okay, because glucose which has increased the also concentration, glucose has increased the concentration of your blood, and because of the osmosis, the glucose will leave the blood as soon as it reaches the kidneys, okay. So GFR rate, it usually functions on the osmotic pressure and all, okay. So now the blood from in the body is on the concentrated level, okay, it has too much of glucose, too much of ketones and all, it has a lot of concentrate uh, levels, okay, so that will create an osmotic pressure that it will push it itself. The molecules will move out of the blood at the first chance they get in the kidney. Okay, and because of this osmolality, urination will increase. Okay, so that is polyuria and nocturia. Polyuria, you urinate a lot. Nocturia, especially at night, you will urinate a lot. Okay, you will wake up from the sleep and all to urinate. Polydipsia, thirsty, always feeling thirsty. Okay, that is a response to too much of fluid and electrolytes being lost by your body. It's your body's response as well to maintain it. So you will feel thirsty a lot. Then polyphagia, always hungry. You will try to eat a lot, but nothing sticks to your body much. Okay, because all the fat in the body is getting broken down. So too much of thirst and too much of hunger. Then dehydration, as the glucose level rises, the cellular fluid that all becomes hypertonic in nature. It will leave the cells, and when there is a lot of loss of water and electrolytes from the kidneys, automatically the body gets dehydrated. And even if you're not keeping up with your thirst mechanism, the body will go into a state of dehydration. Fatigue and weight loss, the fats in your body is getting broken down, catabolism as well as lipolysis increases, so because of which weight loss will happen. But your cells are not getting that quick energy through glucose. That's why you will feel tired always. Okay, because the cells don't have energy. Mitochondria does not have enough glucose cells to produce energy. Increased excretion. So symptoms, increased excretion of potassium, magnesium, phosphorus, along with glucose. Okay, when there is glycosuria, too much of glucose and ketone bodies that are getting pushed out of your blood. So what happens is that you will lose a lot of potassium and magnesium, phosphorus as well. Okay. So you will lose a lot of potassium, magnesium, and phosphorus, along with glucose and ketone bodies that are getting lost from the body. Coming to the diagnosis, glycosuria, checking that if urine has too much of glucose, Benedict's test is done. Okay, so there is a Benedict's solution which is blue in color. So you have to mix equal amount of urine sample. Take the urine sample, mix it in Benedict's solution, heat the test tube. Okay, if there is no change in the color, it stays blue, there is no glucose. Okay. If it changes into green or yellowish color, trace amounts of sugar is there. If it is orange, moderate. If it is brick red in color, large amount of glucose is there. Okay, so that is the Benedict's test. Simple test that can be done in community health settings as well. So you just have to collect the urine sample, mix equal amount of Benedict's solution, heat the test tube. Okay. Then ketone urea, you get ketone urea strips. Okay, like this. So you have to dip these strips in completely in the urine that you have collected, urine sample. Okay, and you have to just shake off the excess urine drops. Wait for 15 seconds. The color will change. Okay, and then you will get a comparison sheet on the packet itself, packet of the strip itself. Okay, and you can compare. The darker is the color, higher is the ketone concentration. If it is lighter in color, you don't have ketones in the urine. If ketones are there, means the person is diabetic. Okay. Then you can take a random blood sugar level test. Okay, it should not be more than 200 mg per deciliter any time of the day. Randomly, you can take the RBS test, blood sugar test. If it is more than 200, okay, any time of the day, if you had food or you didn't had food, if it is more than 200, means the person is diabetic. Then you have the GTT, that is glucose tolerance test. This is a confirmatory test, okay, but it takes time. Okay, here you have to start with fasting blood sugar that is taken, and then at least 75 gram of glucose mixed in lemon water is given, and your blood glucose level will be checked for every 30 minutes, and it will be plotted on the graph. Okay, so this is the normal. This black line you can see, that is normal. Okay, in the fasting blood sugar level, it was less than 100, and 75 grams of glucose was given. Slightly it increased. Within 1 hour, the blood glucose level increased nearly up to 140, and by the end of 2.5, 2.5 hours, it came back to normal from where it started. Okay, this is a normal person's graph. But if it was a diabetic person, you can see the fasting blood sugar itself was more than 100. Okay, the fasting blood sugar level was around 140 something. And when the 75 grams of glucose was given, it peaked up till 250. Okay, within 1 hour, the blood glucose level went up to 250. And when it is coming down, it's not coming down to its from where it started. Okay, it is still high, and even after 2.5 hours, it has not come back to normal. It is still high. Okay, so that is diabetes. This kind of a graph is a diabetes. So this is glucose tolerance test. Every half an hour you have to plot the graph. Okay, this is where fasting blood sugar was taken and immediately plotted. 75 grams was given every half an hour. You can see like 0, 30 minutes, 1 hour, 1.3, 1.1.5 hour, 2 hours, 2.5 hours, like that. Every half an hour, the blood test will be done. Okay, and whatever is the result coming, it will be plotted on the graph. So that is GTT. So in impaired glucose tolerance, you can see here this red line, that is the impaired glucose tolerance. Okay, even after 2.5 hours, the blood sugar level didn't come back to normal from where it was. Okay. Coming to the treatment part of it, there are different principles of treatment: diet plus hypoglycemic drugs. In some cases, diet, hypoglycemic drugs, and insulin also has to be given. Okay. Repeated urine testing or blood glucose monitoring, regularly blood glucose monitoring has to be done. Okay, these are the principles of treatment. Diet, there are a lot of food exchange list. You can WhatsApp me if you need the food exchange list. I'll forward you the diabetes food exchange list. Okay, so you can go through those article to understand. Food exchange list means day 1 to day 7 on a weekly basis. Instead of giving the same food, what variety you can include in a diabetic patient's diet so that it's healthy as well for them and it is not monotonous. Okay, it's not, you're not making the same recipe again and again. You provide variety which can control the blood sugar level as well. So coming to diet and hypoglycemic drugs that the doctors will prescribe which drug is required, what is the dosage of it, frequency of it. Okay, so that can work in some cases. Insulin, usually with type 1 diabetes, insulin is required. Okay, and based on the stage of diabetes, the insulin units will also change. In some people, they may require hypoglycemic drugs along with insulin. Okay, and in some people, hypoglycemic drugs is not required. Just with insulin, they can manage. So even on the food exchange list that is available in your textbook, you can go through that as well. It is in the page 24. Your textbook may have different page number, but it's in the chapter menu planning that we have done already. In that chapter of menu planning, food exchange list is there. You can refer that as well. Okay. Principles of diet we will discuss soon. Then you will understand the diet part. Then Daphne, it is dose adjusted for normal eating. Okay. Dose here, it refers to the insulin dose as well as the hypoglycemic drugs dose, adjusted in such a way that it does not feel very new to the person to eat the food that they were regularly eating. Okay, the doses will take care, the dose prescribed from the insulin or the hypoglycemic drugs, that will take care that the person is having normal quantity and amount of food without feeling that they're losing out a lot on varieties. Okay, so based on their eating style, eating requirement, nutritional requirement, okay, it should fulfill the nutritional requirement as well, but it should not affect the blood glucose levels. Okay, so dose is adjusted just to control the blood glucose level, but the person can eat as much variety as they can. Okay, so that is the Daphne diet plan. Some people are on short acting insulin, some are on rapid acting insulin, or some people are on long acting insulin. Okay, so short acting insulin and all, immediately you have to eat soon after the food or soon before you have the food, immediately within that time frame you have to take the insulin shot. Long acting insulin, once a day you can take, and it can control your blood glucose level for a very long time. Okay, so that these are the different types of insulin that you don't have to go in detail with. So in addition to regular breakfast and other 2 meals, evening tea, okay, five meals a day the patient can have, along with their hypoglycemic drugs or insulin, that it feels normal. Their food challenges are not too much. The goal here is to make their life as normal as possible. Okay, just because they're diabetes, they are very far away from the normal eating pattern and all. That should not be uh, a problem. Okay, their routine is maintained. Okay, with the help of clinical management. That is the goal of Daphne, and living a normal life as much as possible. Okay. Coming to the nutritional requirement, 25 kilocalories body weight, whatever is the weight of the patient diagnosed with diabetes, if they are given 25 kilocalories per kg body weight, that is enough. Okay. But the calorie intake also depends on their activity level. In hospitalized patients, 25 kilocalories is enough. But when they go back to their normal routine work, based on their activity level, the calorie intake may vary. Okay. If they're obese and overweight, it should be between 20 to 25 kilocalories per body per kg. And based on the activity level, a small table is given. You can just go through that. So carbohydrate in their 5 course meal or uh, 4 course meal or 3 meals a day, whatever is the plan. Okay. 45 to 60% of the energy of the calories should come from carbohydrates. Okay. So that should be the target. High fiber diet and low glycemic index food is preferred here. That you will find in the article that I will share you. Just a second. Yeah. So 45 to 60% calories should come from carbohydrates. Focus on the carbohydrates that have low glycemic index, complex carbohydrates, okay? High fiber ones. Monosaccharides or oligosaccharides, disaccharides and all, avoid it. Like sweets, chocolates, sweet drinks and all, avoid that. Avoid simple sugars as well. Eat a lot of millets, multigrain with rice bran or wheat bran. Okay, so that will make the carbohydrates complex in nature. Protein, high protein diet, except in case where a renal disorder is there. Because if you have been diagnosed with a kidney disorder or any kidney dysfunction, protein requirement will be given by the nephrologist. Okay, they will guide how much protein and what kind of protein should be given. Okay. But generally, if there is no kidney disorder at all, then in that case, you can give a high protein diet. Fat, 20 to 25% of visible fat is enough. Usually, if the patient is overweight or obese, keep it under 25 grams of visible fat. Low fat diet is better tolerated in diabetic patients. And that too, choose polyunsaturated fatty acids, that is vegetable oils and all, seed oils, vegetable oils. Those are polyunsaturated fatty acids. Because saturated fatty acids can With diabetes, if you still continue with saturated fatty acids, it can increase your risk for cardiovascular diseases as well. Less than 1200 kilocalories, you require micronutrient supplementation, because not just for diabetic patients, but even for a normal person who is very diet conscious, or who is on a road to lose weight. Okay, when they reduce their calories so much, less than 1200 and all, you have to take supplements for to prevent any nutritional deficiencies. Okay. Soluble fiber, at least 20 to 25 grams per day should be there. You can add psyllium husk, isabgol and all to your regular eating pattern. Okay. Have fruits, fresh vegetables, salad, at least salads during your dinner, and during lunch, it should be compulsory. Okay. So with that, you can target 25 to 25 grams of fiber per day. Fenugreek seeds, at least 25 grams of fenugreek seeds per day in any form. Okay, even if you have the soaked fenugreek seeds water, or you use the methi powder in your curries and all. Okay, it's ideal. Fenugreek seeds can control the blood sugar level. Methi seeds. So they have this special this fiber, galactomannan, that is the soluble fiber found in methi seeds, that slows the absorption of glucose in the intestine. And even if you consume 5 to 10 gram of fenugreek seeds a day, in any form, powdered form, roasted form, okay. If you use this tadka, like just like how you do the raika tadka, in South India, fenugreek seeds are also used in little bit. They are used in tadkas and all. Okay, like that also you can consume. Okay. Artificial sweeteners, if you still have a sweet tooth, artificial sweeteners, zero calorie sweeteners are available. Nowadays, stevia and monk fruit sweeteners are on the most commonly used ones. Okay. Aspartame and all, they are still under scrutiny for their link to certain kind of cancers and all. But you have to use immensely high quantities of aspartame, asulfame. Okay, immensely high quantities of this, which is usually in a human setting, it is very rare to happen. But still, if given a choice, it's better to choose natural sweeteners like stevia and monk fruit. They come from natural sources, so it is much more well tolerated in the body. Okay, so these are some brand name of common sweeteners. Generic name is on the left side, brand name is on the right side. Some of them are zero calorie, low calorie. Okay, there are low calorie sweeteners as well, which some amount of calories will be there in them. Glycemic index, it's a ranking system that food, all the different types of food, especially which has carbohydrate, food that have carbohydrate. Okay, those are ranked on this glycemic index. Okay, what does glycemic index tell? How rapidly the carbohydrate from this food will be absorbed in your intestine, how rapidly it will increase the blood sugar level, and how rapidly or how slowly it will come back to normal. Okay, so based on this characteristic of various food, glycemic index is calculated. Okay, carbohydrates that have low glycemic index, 55 or less, are the ones that we usually ask the diabetic patients as well as people who are using glycemic index to lose weight. Okay, for them it is prescribed. Be in the food categories which have low glycemic index. Carbohydrates that have a high glycemic index, which is more than 70, they will cause immediate spike in your blood glucose level, and they will crash immediately as well. Okay, so the energy is not sustained. But in low glycemic index food, you will get a sustained energy. Okay, you will not get a peak and a crash. You will get sustained energy. And if at all you have to eat some food that comes under the high glycemic index, for example, watermelon. For summers, watermelon is really good. It's something that you want to have. Um, but watermelon has high glycemic index around 72. Okay, so how do you have it? If you have it with little bit with feta cheese and all, if you add a little bit of olive oil and make a feta cheese watermelon salad, okay. So in if you consume the food like that, add little bit protein and fat into any high glycemic index food, the way how it will be absorbed in the body will reduce. Okay, the how the glucose from that food will be absorbed in the body will reduce because of the presence of protein and fat. Okay, so like that tricks you have to use. So these are the fruits and vegetables which come under different glycemic index category. A number is given adjacent to each of those fruits, vegetables, cereals, and all. So you can see all the fruits and vegetables and cereals which come under 55 are the ones you usually prescribe for a diabetic patient. So you can take a screenshot of it as well if you require. Dietary guidelines, you can just read through. It's like a simple read through that is given. How much energy intake should be there. Okay, or you can follow Broca index and all for guideline. Like Broca index is minus your height from minus 100 centimeter from your total height. That is the weight that you have to maintain. For example, if somebody is 175 centimeter, that is the height. Okay, minus 100. So 75 centimeters, 75. 75 is the kg, is the weight that they have to maintain. That is Broca index. Very simple. Okay, that is the ideal weight that they have to maintain. Fish and chicken is usually preferred for diabetic patients as compared to red meat because it has a risk of leading to cardiovascular diseases. Fried food and everything has to be restricted. Soluble fiber is compulsory. Okay, add legumes, whole grain, fenugreek seeds in your diet. Millets should be consumed. Try to avoid refined cereals. High protein can help insulin production and uptake. Vitamin and mineral supplementation in forms of supplements can be given. Especially if it is a senior citizen, it should be given. Multivitamin supplements should be given. Short and regular frequent meals. Following a food schedule is ideal. Avoid alcoholism, smoking, and all. Avoid fasting and feasting. Okay. Overeating and no eating. Okay, that has to be avoided. Ensure that there is variety in food. So these are the some dietary guidelines. You can just read through it. You will understand. Okay. So these are the fruits which have specific glycemic index and glycemic load. You can just go through it, because when it comes to fruits, it is very tricky. Usually, you consider fruits as healthy, but not all fruits can be well tolerated in a diabetic patient. Physical activity, if you are going through, if the patient is going through a stage of hyperglycemia or hypoglycemia, avoid any physical activity. Okay. You will fall down or you will faint. Okay, this thing can happen in both these situations. So when you know your blood glucose levels are too low or too high, avoid any rigorous physical activity. Otherwise, moderate intensity aerobic activities can be done, like brisk walking, jogging, gardening. Okay, that can be done. So 150 minutes of minutes per week, that much if you're walking, that is also fine. 30 minutes a day, 45 minutes a day. Okay, if you're spending in physical activity, moderate intensity is fine. And right before and after a meal, if you're exercising, that is good, because that ensures glucose uptake by the cells. It will prevent insulin resistance. Complications. Hypoglycemia is life threatening as well, along with hypotension and hypoglycemia, both. If is a life threatening condition, person can go into a stage of coma, okay, in case of hypoglycemia. So immediately, if people with diabetes, they usually carry around glucose biscuit or something sweet, that if they feel that their blood sugar level is going down, they feel dizzy. Okay, blurring of vision will be there, dizziness will be there. Okay, these are the signs and symptoms. Immediately they have to eat something, have a lemon juice or have something, so that hypoglycemia can be cancelled out. Okay. Some glucose tablets also they can carry with them. Then ketoacidosis, any form of stress, especially when it comes to infection, or not taking care to get rid of the ketoacidosis, that can lead to inflammation in the body. It can increase your thirst, it can increase the amount of urination that is going out of your body. Along with that, electrolytes and fluid, you will lose that. It will put your body into dehydration, hyperventilation, dehydration. The blood's pH will also go very low. The blood pH will become very acidic in nature. That will also cause other inflammatory reactions. So that is a urgent condition, because this inflammatory reaction will also affect your brain, because brain is also getting the blood, and the brain is getting acidic blood. And if any inflammatory situation takes place in the brain tissues, recover from that could be very tricky. because once the brain cells or tissues are damaged, it is usually irreversible. Okay, so it's an urgent condition. Immediate medical urgency and emergency treatment is required. Infections, wound healing and all is very slow. You have to be very careful. Wear comfortable protective footwear. Okay, because if your fingers, toes, or foot anywhere in the feet you get hurt, it will be very difficult to heal quickly from that. Immediately, in severe cases of diabetes, like people who suffer from uh, 400 mg, 500 mg, 350 mg, that is the glucose level in the blood. And if they get any toe infection, or if they get a small wound or bruise in the feet, there are high chances it would lead to diabetic foot. Okay, and the foot have to be amputated to prevent the spread of infection. So these are the complications. Cataract retinopathy, uh, being diabetic from the past 10 years, 12, 20 years, body is in a state of inflammation. Okay, even though you are trying to control the blood sugar levels with hyperglycemic drugs, insulin, but still inflammation will not fade away. Okay, whenever the blood, usually 50-60% of the times blood sugar levels are high. Okay, so that constant rise in the blood sugar level have triggered a cascade of inflammatory reaction, either in your kidneys, your eyes, retina. So based on which tissues are affected, the pathological reaction of that area will begin. So if it is the retina, it will lead to retinopathy, cataract and all. And if it is kidneys, it will lead to nephropathy. Heart and other heart-related diseases, risk increases, cardiovascular diseases risk increases with diabetes. The more time your body has been diabetic, more will be the risk of developing cardiovascular diseases. Nephropathy, as I mentioned, kidneys are under constant pressure to push out excess glucose. Okay, after a certain time, kidneys will slowly start to give up. The GFR rate and all will go down. Kidneys will slowly start to give up. That is how nephropathy happens. There are other forms of diabetes like pre-gestational diabetes. Here, we know that the woman is diabetic and she has got pregnant. Okay, so during her pregnancy, she also have to take a diet, that is diabetic diet, along with her hypoglycemic medications, either insulin or hypoglycemic drugs. Okay, so that is pre-gestational diabetes. Before pregnancy, she already was diabetic. Okay, then you have gestational diabetes. It is defined as glucose intolerance only during pregnancy. As soon as the pregnancy is over, the woman is also back to normal, but she will always be at the risk of developing early diabetes in her later stage of life. Okay, so with pregnancy, diabetes came, and after labor, diabetes went away. Okay, during that 9 months, 10 months, the diabetes was there. So whoever had the GD, gestational diabetes, they have a risk of developing diabetes later on in the life. They are a high risk group. When it comes to alcoholism, avoid it. Avoid drinking alcohol. It can significantly impact your blood glucose level, especially when you're taking medication as well. So always, if you are engaged in drinking and you are diabetic, your patient is diabetic, they have to be very regular with their blood glucose level test and all. Never drink on empty stomach. Dietary supplements, you can take fenugreek seeds on a daily basis, fenugreek water and all. Cinnamon, if you're having fruits like apple, pears and all, okay, just put some cinnamon powder on it. It can reduce the glucose absorption. Okay, so cinnamon can reduce the hyperglycemia. So if you are eating anything sweet, like fruits that are on the sweeter side, put some cinnamon powder on that and eat. It will control the blood glucose absorption. Bitter gourd, that everyone knows, okay? The juice of bitter gourd and all, it is a diabetic herb. It's used as a medicinal plant for diabetes. Aloe vera as well, aloe vera juice and all. They are diabetic friendly. It has a lot of soluble fiber as well. Gurmad powder, so it's a leaf. It's an Ayurvedic treatment, okay, Ayurvedic herb that is prescribed for controlling the blood glucose level. So that's about diabetes. If you have any queries, you can mention in the chat box.